The criterion 6 is related to the governance, leadership, and management. Ladies and gentlemen, at the end of this session, we shall be able to understand the weightage for criterion 6 and this key indicators, enumerate the quantitative and the qualitative matrices, and we comprehend the required documentation for this particular criterion. Criterion 6, friends, total marks are 100, and the different indicators include institutional vision and leadership, the strategy, development, and deployment, faculty empowerment strategies, the financial management and resource mobilization, and I'm going to talk to you in detail about the internal quality assurance system. Friends, this is the only criterion where the qualitative weightage is more than the quantitative. Amongst all the 7 criterion, this is the only criterion where the qualitative weightage is more. There are 15 questions. We have got 8 qualitative, 7 quantitative. When you talk of the weightage is 51 for qualitative and 49 for quantitative. First and foremost, when you talk of the institutional vision and leadership for 10 marks, the 2 statements, the 2 questions which are there under this particular heading, the first one, that is, the institution has a clearly stated vision and mission which are reflected in its academic and administrative governance. And the second one is related to the effective leadership which is reflected in various
Your voice is not clear.
How is it clear? Now is it clear?
Yes.
Yes. So the vision statement, the perspective plan, the participation in the decision-making bodies, and activities which have led to institutional excellence. Now, when I say achievements or activities which are related to institutional excellence, they will come in different domains. They may be related to academics, they may be related to research, they may be related to your infrastructure, they may be related to your governance, or they may be related to certain best practices. So all those would be certain specific highlighted activities which have actually made a difference in the last 5 years in the working of your institution in a positive manner. That is, they have led to institutional excellence. The other issues which are led to 6.1.2 are in terms of organogram. Organogram means your institutional hierarchy, starting from your dean or your management, whatever it is, till the lowest cadre, whatever is there, the official cadre which is there in your institution. The participatory management and the outcomes. Which are the various committees? I'm going to talk of the various committees in detail and the outcomes, significant outcomes as a result of functioning of these activities. We understand that there are several committees in an institution, but there are certain defunct committees. Defunct means the members themselves don't know that they are in a committee. Then that becomes a defunct committee. So such type of committees, most committees are also there, that is, they exist only on paper. So those have got no meaning. They cannot have any role in the institutional outcome, in the institutional governance. So that will not take into consideration such ghost committees or on paper committees. The institution has well-defined organizational structure, statutory committees, and strategic plan. I told you that organogram and the perspective plan. 6.2.2, I'm coming to it later. So what we require is the description. We require all the data coming onto your website, institutional website, the strategic plan documentation. And when I talk of various committees, what I need is the minutes of the various meetings. And I told you it will not stop only with the minutes, but we need to have specific action taken report. Now look here, I'm going to show you the slide wherein any institution, any health science institution has a college and has a hospital. So I'm going to give you an exhaustive list of the committees for college and committees for hospital. Some of these may not be applicable to Ayurveda faculty. Leave those, the rest, around 90% of them are applicable to you also. So when I talk of the college, we need to have a UG training, a PG training, internal assessment, learning resource center, website, student council, college council, scientific committee, ethics committee, animal ethics committee, committee for extension activities, the internal complaint cell, grievance redressal, hostel, feedback, parent-teacher association, alumni association, anti-ragging committee, and anti-ragging SPAD. These are separate and are mandatory. Green audit. Hospital infection control, the mortality, the clinical meeting, the blood transfusion, diet, grievance redressal. For the hospital, when I talk of grievance redressal, it is with reference to naturally the patient safety, and the pharmacovigilance may or may not be there for your setup. We need to have committee looking into the medical records, the prescriptions, mortality, hospital infections, proper use of antibiotics, emergency services, laboratory services, blood bank, radiology, but the most important nowadays, which is definitely looked into, and that is related to the biomedical waste management. So that's extremely important. The recruitment policy is something which is looked into very meticulously. Now, when you talk of recruitment policy for the government institutions, there is no problem because there will be an advertisement and there will be a proper interview and the recruitment will be as per the system. Problems are with the some of the private institutions wherein there may be just walk-in type of a facility and anybody can walk in and get appointed as a professor in the afternoon. So that issue will be looked into. We need to have proper recruitment policy. So who has conducted the interview, whether they were external experts, things like that. So as I said, this will not be a problem for the government institutions, but private institutions need to have proper mechanism. Grievance redressal mechanism for the students and for the faculty, for all your stakeholders, that's essential. And the institutional website. Website has to be a dynamic one. Website, I always say, is a double-edged weapon. I have seen certain beautiful websites, but when I went on ground to see the institution only had two rooms. On the website, it was looking very nice, very excellent institution it was looking, and I had very high hopes, but when we reached the ground, it was just two rooms. So they can be deceptive at times, but the data is extremely important, and it has to be a dynamic one and real data. Yes, I told you I would talk of e-governance subsequently, and they have given these specific 5 areas for e-governance related to administration, finance and accounts, student admission and support, examination, academic planning and development. When you give the data, it will be name of the vendor with the contact details, year in which it was implemented, the entire document for enterprise resource planning, the screenshots of the user interfaces, the e-governance architecture document, all the complete details of the governance, and specific budget allocation in your institute budget for implementation of e-governance. How much importance or you are giving to e-governance will be looked into. These 5 criteria are given by NAAC themselves. When I talk of faculty empowerment strategies, the question is the institution has effective welfare measures for teaching and non-teaching staff. So separately, this is a descriptive one, but when you say you have a facility, the PhDs when they come, they will be looking into actually these facilities. So when you enlist, please see to it that you have it actually on ground. The next question is average percentage of teachers provided with financial support to attend conferences, workshops, and towards membership fee of professional bodies during the last 5 years. Details are very straightforward. Name of the teacher, event attended for which financial support is provided, or the professional body for which the membership fee is provided. Professional body means professional body. We are not talking of Rotary Club or Lions Club here. Average number of professional development or administrative training programs organized by the institution during the last 5 years for teaching, non-teaching staff. So, like this one, which is organized by UHS for you all. This is a faculty development program. This is administrative training program organized by UHS for you all. So, relevant circulars, brochures, event reports. Average percentage of teachers undergoing online or face-to-face faculty development program during the last 5 years. Now, here you will find one word like AQAR. Now, AQAR is an annual quality assurance report. This will be prepared by the IQAC, that is the internal quality assurance cell, once it is established in our institution. All these, the next slide is related to IQAC, so I'll talk to you on that at that time. So here again, name of the teacher, name of the program attended, the duration of that particular program, and the relevant certificate. Very, very important. That is, the institute has performance appraisal system for teaching and non-teaching staff. Now look here, this is again very nicely done for the government institutions because your APAR or your confidential reports are a part and parcel of the complete governance. So that's okay too. But what is more important, even in government, see whether it is linked to the incentives. That means a person who is doing well, whether proper incentives are given to them or not. Maybe in the form of promotion, it may be in the form of an increment, something, or it may be an additional responsibility given to that individual because of his excellent credentials. So something like that. So your policy document should be in place, description in 500 words, and appropriate website links. But then they may be seeing some reports, 2 or 3 reports, representative reports, and what actually was done for those who have been doing well. At the same time, those who have not been performing well, whether appropriate counseling letters were given to them and they were picked up at proper time periods or not. The financial management. Now, this is your finance department has to look into. That is the institutional strategies for mobilization of the funds, whether the internal, external financial audits are conducted. This is a part regular thing done by all the institutions, but whether it is done with proper decorum. The funds grants received from government or non-government bodies, individuals, philanthropists. Now, this data 6.4.3 is the amount separately from that you have received for research. There will be certain other agencies or some organizations which may give funds to some institutions. They are not for research. Where will you include those? Those are to be included in 6.4.3. Whereas the funds which we receive from ICMR or some research funding agencies, that will come in criteria number 3. So you need to have the descriptions, website link, name of the funding agencies, the funds which are received, the annual statement of accounts, procedures for optimal utilization, copies of the letters for the various grants which are received, and the audited statement accounts, and you have to highlight the relevant expense. Yes, this is the most important thing when any institution is going for accreditation, and that is the internal quality assurance cell. So all of you will be establishing an internal quality assurance cell. So the questions are, the institution has streamlined internal quality assurance mechanism. Now, what is this IQAC cell? Who are the members? Of course, the dean or the principal will be the chairman, but you need to have an IQAC coordinator. Now, who will be an IQAC coordinator? The person has to be of rank of professor. There is a reason for this. The person should command respect. Person should be self-motivated. Now, if the coordinator himself is a dull person who himself is coming only once in a week, or those guest artists which are there in the institution, or he himself is not motivated and he himself takes it as a burden on him, then he cannot motivate other faculty. So, full-time faculty of the rank of professor, self-motivated, of very high integrity, of good national repute, self-motivated, and commands respect, not demands, commands respect, that person should be an IQAC person. Along with that, 4 or 5 faculty members, 3 or 4 administrative officers, undergraduate student, postgraduate student with gender representation, proper gender representation, 1 alumni representative, 1 person from the industry. So all these make up, and in case of private institutions, from the management also. So this will be your IQAC, and they will be controlling all the activities, all the events pertaining to the 7 criteria. So like that we always say it is called as the heart of the institution. So IQAC, and then they will be preparing the annual quality assurance report every year. So the average percentage of teachers attending workshops, programs, seminars specific to quality improvement. Like this one is quality improvement seminar organized by your university. Institution adopts several quality assurance initiatives. So what are those? Look here. The feedback from the stakeholders is a quality initiative. But feedback, if you see, in the afternoon you're going to have criteria number 1, wherein they'll be discussing about feedback. It is not only about obtaining feedback. Suppose you have taken feedback from your patients for quality services in the hospital, improving the quality of hospital services. If you have just taken feedback, it is of no use. There is the committee which is analyzing the feedback. And only if you have analyzed also, it is of no use. Whether the action has been taken on the feedback that was received. That is very important. So the cycle has to be completed. First of all, feedback mechanism has to be in place. Somebody has to take the feedback. Some committee has to analyze it, outline the deficiencies, and take action on that. So that is the cycle which is complete. So those are quality initiatives. Workshops on quality initiatives. Preparation of documents, say for NAAC, for NABH, for ISO certification, NABL accreditation for laboratories, or if you are taking part in the National Institution Ranking Framework by UGC, that means the NIRF ranking. So all these are quality initiatives. So if that is being done, then that would be taken as a quality initiative, certified quality initiative. The minutes of the IQAC meetings are extremely essential. So IQAC has to focus into teaching learning reforms, administrative reforms, and once in 3 years, they should conduct an academic and administrative audit. That is called as a AAA committee. So that is extremely essential. AAA committee means there will be 3 external members, academicians of repute, who will visit your institution and look into all these 7 criteria, say for 2 days. So that visit must be conducted and they'll give you certain recommendations. So NAAC is once in 5 years. This usually you conduct once in 2 or 3 years, academic audits. You can have 2 audits in 5 years. And based on then whether the IPSC has looked into the recommendations given by these committees will also be looked into by NAAC. So this is sort of an official activity which is conducted by the IPSC of the institution that is called as a AAA committee, the Academic Administrative Audit Committee. So to conclude, ladies and gentlemen, for criteria number 6, what are the key points? Take-home messages. The vision and mission statements should be displayed clearly and known to all stakeholders. Who are our stakeholders? The students, their parents, the patients, their relatives, our colleagues, our peers, everybody, all are important stakeholders. Participative management is the key to successful outcome. The I has to be replaced by we. It's about a teamwork. Standard operating procedures for all committees should be in place and strictly implemented. It is not only that suddenly in the afternoon somebody feels that we will have a committee today for UG training. Certain 2-3 people just gather, write something and disappear. That is not accepted. Standard operating procedures means that people, the composition of the committee, the tenure of the committee, the objectives of the committee, the documentation for the committee proceedings, who's going to take care of the records, who's going to sign the records, all those things are extremely important. That is called as a policy document. That is called as a standard operating procedure. If a faculty from that committee proceeds on leave, who is going to take charge of that? All that will be recorded in that particular SOP. Faculty development programs serve as a good investment, and tapping good talent is the essence of good governance. So selection of your faculty, mind well. Any institution is not made by your marble or your chandeliers or your lighting or illumination. Who is going to illuminate your environment? It is going to be the quality of the faculty, the quality of the students in the institution that being okay. So that is something which is extremely important. So invest on human resource, and that's going to take you towards the path, the correct path for quality assurance, ladies and gentlemen. And we always say the internal quality assurance cell is the heart of any institution. So take self-motivated people who will not take this activity as a burden. If you take this activity as a burden, I think that is the beginning of the end. So we need to be really motivated, and the very fact that you are the people who are attending this particular, I'm sure you are the ones who are going to be the torch bearers for your institution. The amount of questions that you ask me for criterion 5, I'm sure they're going to be double the number of questions that you ask for criterion 5 will be for 6. But I really appreciate the enthusiasm. So you are the torch bearers. You are the flag. You are the ones who are going to march forward towards quality assurance, taking your institution to the pinnacle of success. And that's what is expected from each one of you. Thank you, ladies and gentlemen. I'm open for now questions for criterion 6.
One question, sir, regarding a very nice talk on this topic by you. One question regarding support by the institute for teachers to participate in seminars, conferences.
Yes.
So currently in government institutions, that system is not there. So how to address this point?
If it is not there, then that will be nil data for that particular thing.
But then
There has to be some mechanism by which institution the candidates are given some or the other incentive.
okay, and the leaves are sanctioned, but the monetary or the financial support is not given.
Duty leave can be included in this, sir.
Good question.
Can it be included? Because
No.
financial support.
They are asked specifically for the financial support. So
Then we have to strive
if any
for
registration fee is paid or something like that, so that will be only looked into.
But sir, some of the seminars are arranged by the central government. So the participant, they pay to and fro the charges, including the residential lodging charges also.
Who pays? The institute pays or the faculty pays?
no,
The government.
The organizers. That is the government.
So then you mentioned that. So you did not have to pay anything, na?
Yes, yes.
So then that has to be that has to be included in this.
Okay. And one more
For
point.
you, if you are a government institution, the government is only your guardian.
And sir, one more point.
But what about the private institute, sir? Then
Private institutes have to now look into all these issues and have to support their faculty for and give them the required incentives.
And one more point, sir, regarding FDP, that is Faculty Development Program and seminars specific to quality improvement of the teachers. What is the difference between FDP and seminars specific to quality improvement?
Yes, a very, very apt question, and every faculty we are facing this particular question. Very, very essential. Now, FDP and specifically related to quality initiatives. When I take my example, now surgery. Now, if I hold tomorrow an update which is related to colorectal surgery, that becomes a faculty development program for me and my faculty in surgery. But tomorrow, I hold a workshop on curricular revision. I hold a workshop on dynamics of paper setting. These become quality initiatives for the teaching learning process. Tomorrow, I hold a workshop on intellectual property rights. That becomes a quality initiative related to research activities. So, like that, we need to organize events which are not related to your discipline, but in general, which contribute to the institution environment improvement as a whole.
Okay. Sir, participation of teachers in basic MET and advanced MET and research methodology workshops organized by university can be considered under quality improvement?
100%.
Can they be considered under quality improvement?
Yes, they should be taken.
Okay. And one more.
Because these workshops are related to the research methodology. They tell you the importance of the how to assess the impact factor of a journal, where to publish. So these are all quality initiatives.
Okay.
The components, see the content of those programs, see the content of the research methodology, see the content of basic medical education. They teach you how to set a paper.
Yes, sir.
So like that. So if these issues are being tackled to improve the process, the teaching learning process, the evaluation process, the research development, all those are quality initiatives.
And one more question regarding to external and internal audits. Can you elaborate on internal and external audits?
Yeah, internal and external audit. Naturally, it's self-explanatory. When I talk about external, administrative, academic, and administrative audit, which is to be done, that means all the members, usually 3 or 4 members will be there, depending on the number of departments in your institution. They all will be external members. Internal audit means, say, one department faculty assesses the other department faculty. So you can conduct those exercises at institutional level itself, internal exercise. That will also help. Like that can be a mock drill for you all. So, one department assessing another department. But all this will be conducted under the ambit of IQAC, the Internal Quality Assurance Cell.
Can the LIC of university be considered as an external audit?
The problem with the LIC is reflective. Look at the objective of LIC. LIC is coming with only a specific objective, say for giving you permission for starting a new course or a program or increasing seats and things like that. So their area is very limited. They are not looking into the quality initiatives. Remember.
No, but now currently they have started this impact assessment as per the NAAC points.
Yes. I was involved in that.
So can this be included?
LIC is different, impact assessment is different. If there is impact assessment, it is to be included. LIC, no.
Okay, sir.
One question. Sir, for example, for NAAC criterion, we have conducted teaching program for faculty development program for all the teachers. Like NAAC criterion head, first head, criterion head will explain how the criterion or how the work of the criterion should be done. So whether it can be included in FDP or not.
Yes. Only thing is that show it under a proper. So prepare a brochure for it.
Okay.
Prepare a banner for it.
Okay.
Let it come under the ambit of the IPSC of the institution. Like that. So give it a sort of an event. It should be like an event which is being conducted. Bring it under the IPSC. Definitely, it will be taken as a quality initiative.
Okay. Thank you.
I have mentioned that quality initiative when you are preparing your documents for NAAC or NEBH or NEBL or ISO or you're participating in NIRF program of UGC, all these are quality initiatives.
Okay, thank you.
Sir, I have a question. May I ask, please?
One question at a time. Yeah, Madam Maya, please. Yeah.
Yes. How to form the e-governance architecture document, and is there any format of guidelines to form the policy document, and who has got the authorization to form these policies?
Yes, very apt question, because this will not only include for the IL, because some of the questions asked by Madam Maya are not only for e-governance, for all committees. That who has an authority to prepare these policy documents? Now, see, you are an institution, you are the boss. The dean or the who has to execute, that person will be the boss. The dean or the principal of the institution will be the signing authority for all the documents. No document will be considered by NAAC unless and until it is attested by the dean or the principal or the head of the institution. That's point number. All the records that are to be uploaded, each and every paper has to be signed, authenticated by the head of the institution. That's point number one. Point number two, when you talk of e-governance architecture document, the NAAC has specifically mentioned those 5 headings under which that e-governance is to be looked into. So we need to have, your software needs to have the modules for all these 5 ingredients. If it is related to administration, the student support, the examination, so it comprises of the modules. So for the e-governance architecture means, first of all, you have to have these 5. Who is in charge of this? You have to have e-governance. Suppose when you talk of the data related, suppose we talk of the teaching learning process. That means who is going to mark the attendance? Now, attendance, when we talk of attendance, is related to UG attendance, PG attendance. So, who are going to come into picture? Your administrative staff of your UG section, your PG section, all those people will be included. But you have to identify a specific person who is going to look into the e-governance. So, the architecture will be related to the content and as well as who is accountable for that particular data. That becomes your architecture document.
Sir, my question is regarding vision mission.
Thank you, sir.
Is it necessary to change the vision mission yearly, or it should be fixed for 5 years?
I really appreciate your question, but it will be a it will be a big fiasco if we change it every year. It cannot be changed every year. So the vision and mission, because we have to work. See, when you formulate a vision and mission statement, your activities for 5 years have to be in accordance with what vision and mission you have stated. If you change it every year, that means it's a fluctuating mind. That means that thing can never work.
Hello, sir. Hello. Sir, which committees are not required for Ayurveda faculty?
You have to select from the list which I have taken for.
Hello.
Yeah.
Sir, which committees are not required for Ayurveda faculty?
That you have to tell me. Because I have given you a complete list. Out of that, you see which is relevant to. I found everything, almost everything is related to the Ayurveda faculty. If you ask me any question, a specific committee you feel that it is not related to Ayurveda, I'll tell you.
Okay, okay, sir.
Yes.
Hello, sir.
Please.
Is it required to return policy for each committee, each and every committee?
Yes. That is not policy, that is called as standard operating procedures.
Okay.
Without that, the committee will not be existing. Because standard operating procedures will comprise of the goal, the objective, the number of the people, what is the composition of that, what is the tenure of the committee, what are the specific roles of each and every member, who is accountable, who is the member secretary, who will sign documents, what about the archival of documents, what will be the discharge of documents, who will be in charge when the person is on leave, everything will come into that.
Okay. Thank you, sir.
Thank you.
Sir, for government institutions,
Yes.
confidential reports submitted to the government
Yes.
are the only documents for appraisals. So will that be sufficient?
Yes. Only thing I told you, the issue comes, so there may be a delay in communication. So somehow the MUHS will have to chip in here and see to it that you are all communicated on time. Sometimes there may be delays in communication of that particular PPR or the annual performance assurance report. Another thing which the NAAC looks into is whether it is linked to the incentives. So that is something which the government also now needs to look into. Whether the proper increments or the promotions, time-based promotions, all those things have to be looked into from the government side also.
Okay, sir. Thank you.
So this, you understand that this process is so nice that in fact it may actually help the hardworking faculty.
Yes.
Sir, may I ask one question?
Please.
Yes, so whatever the criteria that you told about the committees like the SOPs, minutes of the meeting, action taken,
Yes.
is there any standard format for all such things which
No,
we
there is
have
no
to go?
standard. I told you what should be the content. What should be the content I have told you. So accordingly you prepare. There are no standard formats. When you say standard operating procedures for a committee means what? There will be a broad goal and objective why that committee is constituted. Then what is the composition, the tenure, so like that.
Thank you, sir.
हॅलो हा नमस्कार सर.
Yes.
सर कसं आहे आता तुम्ही जसं म्हणलं की या कॉलेजमध्ये टीचिंग स्टाफ आहे किंवा नॉन टीचिंग स्टाफ आहे त्यांचे जे प्रमोशन्स होतात डिपार्टमेंटल प्रमोशन्स तर ते स्टाफच्या अप्रेझल मध्ये आपल्याला त्याचा डाटा तयार करून वापरता येईल का असं विचारायचं.
स्टाफचा प्रेझेंट म्हणजे काय मला कळलं नाही.
नाही आता स्टाफचं जे डिपार्टमेंटल प्रमोशन्स होतात तर त्या डिपार्टमेंटल प्रमोशनचा डाटा आपल्याला ह्याच्यात कुठे अपलोड करता येईल किंवा त्याचा वापर करून घेता येईल का असं मला विचारायचं.
When you say that you are when you say that त्याचा डिस्क्रिप्शन आहे बघा, डिस्क्रिप्शन आहे तो क्वालिटेटिव्ह क्वेश्चन आहे की वेलफेअर मेजर्स फॉर द फॅकल्टी आणि नॉन फॅकल्टी आणि ते किंवा ही अप्रेझल पॉलिसी इज इन प्लेस, क्वालिटेटिव्ह क्वेश्चन आहे. तर क्वालिटेटिव्ह क्वेश्चन मध्ये डिस्क्रिप्शन विचारलंय. आता डिस्क्रिप्शन विचारल्यानंतर आपण त्यात म्हणणार की इट इज लिंक टू इन्सेंटिव्ह. तुम्ही त्याचं सपोर्टिंग डॉक्युमेंट काय मग तुम्ही डेटा द्या ना की ह्या माणसाचं काम एवढ्या लोकांचं 4 जणांना आम्ही खूप 5 स्टार रेटिंग दिलेलं आहे त्याच्यामुळे नॉन टीचिंग स्टाफला है ना एककडनं त्याला समजा अटेंडंट पण त्याला एमपीएससी मध्ये प्रमोट केलेलं आहे.
बरोबर बरोबर. ओके सर, थँक्यू सर.
सर, one question.
Yes, please.
सर, इन हॉस्पिटल ऑडिट, हेल्थ केअर ऑडिट सिस्टीम याच्यामध्ये जेव्हा आपण मॉर्टॅलिटी ऑडिट करतो आयुर्वेदामध्ये मॉर्टॅलिटी ऑडिट होण्यासाठी अगोदर मॉर्टॅलिटी आपल्याकडे व्हायला पाहिजे. आपण इथे जवळच सिव्हिल हॉस्पिटल जर असेल तर आम्ही सगळे पेशंट तिकडे रेफर करतो. लास्ट टाइम जेव्हा आम्ही त्याच्या बाबतीचं रेकॉर्ड ठेवलेलं होतं तर ती मॉर्टॅलिटी ऑडिट याच्यासाठी आपल्याला काय बेसिक क्रायटेरिया ठेवावे लागतात.
तुम्हाला मी चांगला प्रश्न विचारला. What you should do is you should that committee should be named. Actually nowadays it is mentioned not only mortality. I'm sorry, but it should be mortality and morbidity.
Yes.
त्याला मॉर्टॅलिटी आणि मॉर्बिडिटी रिव्ह्यू करा, तुमचा प्रश्न सुटून जाईल. मॉर्टॅलिटी सुटू नये हीच देवाकडे प्रार्थना करायची. मॉर्टॅलिटीसाठी आपण म्हणजे काही रेकॉर्ड क्रिएट करायचे नाही.
Sir, can you throw some light on 6.4.1 institutional strategies for mobilization of funds and optimal utilization of resources? It is
funds म्हणजे मग तेच झालं की तुमचं आता अल्युमनाय असोसिएशन आहे. तर इन्स्टिट्यूशनने काय म्हणजे अल्युमनायनी काय काय म्हणजे कसं तुम्ही त्यांना मोटिवेट करता. इट शुड नॉट बी की अल्युमनाय म्हणजे निघून गेला कॉलेज मधून तो पुढचे कधी आयुष्यात परत तरी तुमच्या इन्स्टिट्यूशन मध्ये येणारच नाही कोणी. तेव्हा तुमचे काय काय व्हिजिटर्स येतात काही तेव्हा मग त्यांना तुम्ही कसं मोटिवेट करता. कोणी तर समजा फॉरेनर एक आला तुमच्या इन्स्टिट्यूशन मध्ये, इफ इज इंटरेस्ट बाय युअर वर्किंग मेथड, ही मे जनरेट सर्टन, ही मे गिव्ह सम सर्टन फाउंडेशन्स आहेत काही तर त्या लोकांना तुम्ही कोणी लोक भेटलाय का, त्यांना सांगितलंय का. कारण हे फंड तेव्हाच येतात जेव्हा हे लोक तुमचं इन्स्टिट्यूट व्हिजिट करतील. ती अंडरस्टँड की reason why this question is asked. When you are able to mobilize funds, that means there is a close bonding between you and society. For developing that particular bond, that society, some members of the society would have visited your institution and they will get impressed only if the processes are in place. तरच तुमच्याकडे कोणीतरी पैसे देईल. जर त्यांना कळलं की इन्स्टिट्यूट मध्ये काहीच नाहीये किंवा सगळं कारभार सगळं असा विचित्र दिसतो तर कोणी फंड्स देणार नाही. तर the reason is that if some of your influential people in your institution, influential in the sense who are having an extra edge for social commitment, they are the ones who can generate such funds.
Okay, thank you, sir.
Thank you.
So another question. How can we conduct the prescription audit?
Yes.
What should be the special?
Yes, prescription audit म्हणजे we all know the standard format for prescription writing. फार मजेशीर आहे बरं काय. आम्ही आमच्या इन्स्टिट्यूशन मध्ये बरेचदा करायला सांगतो सगळ्यांना. कारण का बरेचदा काय होतं, especially in teaching institutions, it is the residents usually who write the prescription. And the way it is written, without the symbol, how many days it is to be taken, what is the dose. So that is how these audits are done. So identify the committee which will be looking into, who will be doing this particular audit. And it has to be random. Say in this month, you just go and take, just randomly you select around 50 prescriptions from one particular OPD. And then you analyze what were the shortcomings. Now again, don't leave it at that. They have to analyze The purpose of any audit is not to punish somebody or to take action on someone. No. In general, make an analysis and present it to that particular department. See, ladies and gentlemen, in month of July, in Department of say Medicine, we in the OPD, we did a prescription audit, out of which we found out of 50, 20 were incomplete. Incomplete in terms of what? The name of the patient was not written clearly. The age of the patient was not written. The gender was not written. These have a bearing on the treatment. The treatment symbol was not there. The items were not written one after the other. They were written in one line only. The dose was not correct. And most important, some prescriptions were not signed by the packet. The stamp of the doctor was not there. The registration number was missing. So things like that have to be looked into.